Hi there, it's Dr. David Johnson here from City to Coast Neurosurgery and the Functional Movement Training Centres at Milton in Brisbane and Mountain Creek on the Sunshine Coast. It gives me a lot of pleasure to put this little video compilation together for you that demonstrates the fairly miraculous improvement in movement and associated improvement in low back pain for one of many of our patients that have been attending our program since we began approximately 1 year ago. The focus of the program is very specifically on improving movement deficiencies in patients, and also in this example a injured worker covered under Work Cover Queensland. This particular injured worker had been to numerous physical therapists, including a very prominent physiotherapy service, and had engaged in roughly 20 hours, 20 physiotherapy sessions over a period of about 3 months, with a duration of pain lasting in the order of 6 months. She was not improving. If anything, she was getting worse with time rather than getting better. She described a lot of passive therapies, a lot of isolated motor control therapy, and numerous interventional procedures to treat pain symptoms such as injections, and also very strong pain medication. What was clearly apparent from her presentation was that there had been no focus on restoring her basic biomechanical sound movement, and this is the foundation of what our program does. It addresses the deficiencies in movement, which really stem from an initial injury. It sets up the process for poor movement and the positive feedback cycle that then results in perpetuating pain. The elements of movement that we focus on are coordination, building in flexibility, and then achieving proficiency in those elements, and then building in strength. We also focus very heavily on intensity training because I believe that we have to allow our patients to develop intensity during their training so that neuroendocrine adaptations can occur. And with the neuroendocrine adaptations, the body changes, muscular strength, coordination, soft tissue integrity, strength, and all those pain generators that are outside the resolution of modern imaging then begin to subside. Many patients have low back pain of chronic nature, and their MRI scans, their CT scans just show normal degenerative changes. And there is a very distinct difference between normal degeneration, which should be absolutely pain-free, as compared to what I term degeneritis, which is degenerative changes that have become painful. And usually the underlying pathology or the underlying root cause of that transition from degeneration to degeneritis is poor movement. Now, movement training is fairly void. There's a big void of movement training in the rehabilitation sphere, and our two centres at Milton and on the Sunshine Coast focus specifically on restoring movement training. We incorporate exercise physiologists, physiotherapists, functional movement coaches, Olympic weightlifting coaches, and all of our coaches are movement coaches. When our physiotherapists are working for us, they are taking their physiotherapy hat off and they are becoming movement coaches. And that is why we're achieving results that are really quite profound. And you'll have to hang 10 until we can get the data collected, because I think just going from our prospective our retrospective audit of outcomes, the results are extremely impressive, and certainly far and beyond current outcomes, which have fairly low evidence on systematic review. of the literature, in particular motor control exercises and cognitive behavioural therapy. Very poor evidence base for their methodology. So yeah, it gives me great pleasure to show you this video. This lady has been in our program for 6 weeks, and after 2 1-hour sessions per week, she is ready to go back to work, and it'll be very clearly apparent to you the restoration of her movement patterns and also the improvement in her pain symptoms. So thank you very much. Has had how many sessions of physiotherapy?
Lost count.
Lost count, so probably about 20 odd?
Twice
20,
a week
and
for the last
discogenic
3
low
months.
back pain, work injury, L5S1 discopathy, aggravation of that disc causing a lot of back pain, and 20 physiotherapy sessions under WorkCover Queensland.
Correct.
WorkCover Queensland paid for them all, and Anna said that she's done some stretching. Most of the other exercises have been done laying supine, squeezing your pelvic floor, done minimal squatting training. And Anna, let's see what you can do to hold that core and squat. Let's see what you can do. I've given her a few tips already. First few trials were terrible. Okay, that's Anna's best attempt after 20 physiotherapy sessions. Try again. She's almost doing a kneel. She's got very poor kinesthetic awareness, and she's finding it difficult to even maintain that posture there. Finding it difficult to get the weights on her heel, get her weight backwards on her heel. She's actually doing a little bit better now. Earlier attempts were with a rolled kyphotic lumbar spine, and that's after 20 physiotherapy sessions. Okay, thanks Anna. We've got a lot of work to do. You're happy for me to send this video into WorkCover Queensland?
Yeah, I think so.
No, it's just so that I can show WorkCover that we need to do some more functional movement training.
Yeah.
Yeah?
Go. Yeah. Let's do 5. And then put it down. Yep. There we go. One more.